the director of the FXB's clinical services, how has the FXB Clinic remained innovative in the care and treatment of those affected by and infected with HIV?
Well, you know, the FXB Clinical Program really prides itself on constantly restructuring its services to really meet the needs of the patients it serves and the community as well. I mean, historically, the FXB Center started out as a pediatric HIV center in the mid-1980s. And so we've evolved since then, over time, to really become a comprehensive center of care for infants, children, now adolescents, because the infants are now growing up into adolescents and young adults, and predominantly women. So we're now a family-centered, community-focused center of primary HIV care services serving that population. So we've actually evolved from being just strictly pediatric HIV into a family center of care. And also, sort of, like in the 1990s, we started a very strong case management program, which again are wraparound services that are really needed in terms of providing excellent care to our patients. In 1990, we received funding for the Family Place, which is a comprehensive outreach case management program, which also deals with crisis intervention services, particularly for the HIV-infected women that we serve. We were finding that a lot of them had social issues and social problems that were really impacting on their health outcomes. And so in the 1990s, we received funding to create the Family Place, which is still in place as we speak. It's a very strong case management program. And then in the 2000, we created another case management program, which was intensive case management, called Healthcare Connections, which is an intensive case management program, which really reflects what we're now talking of the continuity of care cascade. With the Healthcare Connections program, we were actually ahead of the times. We're talking about the continuum of care cascade, and we were actually doing that in the year 2000. And you know, Ryan White funding for that program was really instrumental in developing that and creating that. So again, you know, we were able to use the funds from Ryan White to create these sort of very specific programs which were developed for our patient populations. And the way we do that and sort of keeping cutting edge and using evidence-based practice, we need to know and understand the patients that we serve. We need to know and understand the community within which these patients live. We collect and analyze data over time and look at trends in healthcare and how it's affecting our patient populations. And so based on that, we've also created a very strong continuous quality improvement program, which again evolves out of the Ryan White Care Act and the funding sources as a requirement. So we're continuously collecting data, measuring patient outcomes, and then we're restructuring our services depending on what those patient outcomes are. We also have an active community advisory board, so we always get input and feedback from the patient population that we serve. We have a women's support group, which again is part of that community feedback that we get. And we also conduct patient satisfaction surveys and needs assessments to get feedback from those patients we serve, so we can actually, you know, build our programs around what the needs are of our patients. There are a couple of new initiatives that we have. One is the mental health program, which I'll talk about in a moment, but we also provide high-risk infant and women services, which is not specifically for HIV patients, but it's for those patients who are at high risk for social problems, especially pregnant women. Quite often they are HIV infected, but we do have, it used to be called our border baby services, and these were babies who were put on social hold within the hospital, who were taken out of their families because of social issues, and then we work towards getting them back with their families, and this has really evolved into a very comprehensive program now. And our care coordinator for that program has been really innovative in taking care of HIV pregnant women and pregnant women who are at very high risk for social issues. And she provides a safety net right through their pregnancy and also after delivery for these infants who are in this social hold program. So that's another innovative program that we currently have. One of the newest programs actually that came out of the data that we collect was the realization that we really need to start addressing mental health services on site. And so anecdotally, we realized that a lot of our adolescent teenagers who were perinatally infected had an abundance of mental health problems that weren't being addressed. And so we were able to secure funding to provide on-site mental health programs and services through our social workers providing mental health counseling and psychotherapy, but also with the Department of Child and Adolescent Psychiatry. We've been in this program for a year now. It's been very successful. We've been able to secure more funding to continue that. And so we're actually going to be analyzing the data from that program to see how we can enhance those services and hopefully get more funding to sort of continue those mental health services, which has really bubbled to the top as an issue that has to be addressed within our patient population.